Now, the NICE technology appraisal for this drug talks about using the drug within a specialist weight management service, providing multidisciplinary management of overweight. How can this be achieved?
So at Remedi Health, we take a full clinical history and we take time to question and listen to an individual's weight issues, what they've tried before, what's worked, and their understanding of how this particular medication might work for them. We check that there are no contraindications and that they're not on any medicines that might be an issue. We may also undertake further diagnostic testing to see whether there are any other underlying reasons for gaining or not being able to lose weight. For example, hormonal issues such as low thyroid, or if they're going through the menopause. So no amount of dieting is going to help if your body is not working alongside what you're trying to do. We may also need to know whether somebody's got pre-diabetes or diabetes and needs an onward referral. So we obtain a BMI and waist measurement and take their blood pressure. We do sit down and go through their goals. We use behavioural techniques to support them in whatever change they want to do, and make sure that this is part of a broader health and well-being approach so that they can adopt these practices in the long term. We will always explain the benefits, risks, side effects. At the end of the day, this is a joint decision. It's very person-centered, and they need to decide that this is something that they want to embark on. It's not cheap. It's an expensive treatment, and it could make them feel really quite unwell to start off with. People describe feeling nauseous, having headaches as they titrate up their medicine. And for one of my clients, she's experienced quite a significant amount of reflux and discomfort, which means she can't eat after 4 o'clock in the afternoon. So it is important to recognise that it can take a while to get to a therapeutic dose, and that you have to potentially go through some side effects before you get to somewhere that your body's comfortable with. We'll also go through administration technique, and we'll also check in with them about how frequently they want to come in and be weighed and to talk about progress, how they overcome some of the barriers. And a lot of clients will talk about how this makes them more accountable to their programme and supports weight loss going forward.
Mm-hmm. So are you at Remedi Health providing a multidisciplinary weight management service?
Here at Remedi Health, I'm the main clinician, and I've qualified in a number of behavioural techniques, motivational interviewing, counselling, and also I'm a mental health first aid instructor. And quite often obesity and overweight is a complex area. It's a metabolic condition and disease, but also is quite often underpinned with some difficult relationships with food. So from my perspective, I will support an individual across the board. We also, if we need to do blood tests, etc., either I can take them or we have a team and a phlebotomist who can do that. What's important, I think, is to understand where my competence ends and somebody else needs to begin. So we can make referrals to their GP, to other private practitioners, including an endocrinologist who works with us.
Now I'd like to focus on good governance. So if you are planning to offer an obesity management service, including semaglutide supply, what factors should be taken into account and what safeguards need to be in place?
Clinical governance is incredibly important for us here at Remedi Health and should be for any clinical practitioner. So if any prescriber, when they're setting up a new service, particularly a medicine that hasn't been around for a long time, we don't have long-term safety data. We need to make sure that we're safeguarding our patients and making sure that everything that we do is appropriately documented and supported with evidence. So when setting up a service like this, we should be thinking very much around the clinical governance pillars. We always refer back to those. So that would include making sure we do a full risk assessment, making sure we have standard operating procedures in place, undertaking an audit program of our prescribing to make sure that it's safe and appropriate and that we're following up with people. making sure our team and other practitioners are fully trained, but that importantly, if you are prescribing, then you are doing so within your field of competence, that you have this within your scope of practice, and that you'd be able to evidence any training and shadowing of other practitioners that you've done in order to become competent. We also need to engage our patient in the decision regarding prescribing, so that they're fully informed of risks and benefits. And that's particularly important, as I mentioned earlier, because if it's Ozempic that we're providing, it is off-label. And we also need to make sure that we fully document, that we've got good information governance, records, for example, of batch numbers, expiry, etc., all being kept, so that if there is a recall of any kind, then we're able to trace back patients. So the clinical governance that we put in place is incredibly important. I mentioned earlier some of the concerns around online prescribing, and I understand that some online prescribers are asking for photographs of the client to confirm identity, but also that they are the BMI that they say they are. And this sounds like a good idea, but actually it's not difficult, is it, to post a previous photograph of yourself when perhaps you were a couple of stone heavier, or somebody completely different, a downloaded photograph from the internet, for example. So I think I haven't seen the details around the safeguards and checks, but we always need to be thinking, how can these be circumvented and people can work around them?